The weather's getting colder and the coughs are getting louder, but not all coughs are the same. So let's talk about this. Hi everyone, Dr. Louisa here, and you're welcome back to our podcast. So in today's episode, we're talking about something that's very timely. You know, the sudden shift in Ghana's weather to these colder temperatures, our mini Ghanaian winter. So with this change, many of us have noticed that there's an increase in the cough and flu symptoms, especially among children. So to help us unpack this important topic, we're joined by two incredible guests here today who will shed light on these illnesses and how they affect children. So we have our pediatrician, Dr. Sharon Aglobiche, and then we also have our pharmacist, Frank Ejapom, who will guide us through the safe and effective ways of use of some of these medications. So we'll be exploring why not all cough syrups are the same, meaning that not every cough syrup would work for every type of cough, and why it's especially important to understand the differences when it comes to babies and children. So from dry coughs to chesty coughs, we're going to learn why choosing the right treatment makes all the difference. So stay with us as we dive into how to protect our family's health this season and then to also clear up some of the common myths about cough syrup. Okay, so let's start from the basics, Dr. Sharon. We all know what a cough is, but we want to know what really is the science behind a cough.
Cough is a natural reflex, and it's just the body's way of getting rid of things that are in the respiratory tract that shouldn't be, or the airway where we breathe from that shouldn't be. And what are some of these things? So we are talking about when you have an infection, when you are exposed to dust, mucus, even sometimes in our day-to-day activities, you are drinking water or you are eating and then it goes the wrong way. The body's natural reflex is to react with a cough. And how does that come about? That's because we have little sensors in our respiratory tract that will typically send signals. So once something that is not supposed to be there gets in there, it picks it up, sends a signal. We have a cough center in our brain. So it picks it up, sends it to the cough center in our brain. And then that cough center also sends signals to all the muscles. So we have the muscles on the side, the muscles under the lungs, we call the diaphragm. And it forces us to sort of cough to bring out whatever is there that is not supposed to be there. So that's just how coughs work. And in my case, for example, in the pediatric population, they tend to be more affected with coughs because of their smaller airways and their weaker immune systems as well.
That's very interesting. I'm glad that you mentioned that. So now we know why children come down with coughs more often. Okay. So I've seen patients that would usually have a dry cough that would linger after a cold or a flu, or, wet coughs that seem to worsen their oral hygiene and things like that. Can you help us to explain the difference between a dry cough, a chesty cough, and then whooping cough in children?
Okay. So a dry cough is just what the name says. It's dry. You are coughing and then nothing is coming out. So typically you would get dry coughs in viral infections. You get dry coughs when you're exposed to allergens. So for example, those who have allergies, so we have allergic cough, and then those who have asthma as well, they'll typically have dry coughs. A wet cough is when you are producing mucus, in simple terms, phlegms. So you are coughing and then you're actually bringing out some mucus. It's colored. That is where you term it a wet cough. And you typically see that in infectious coughs like bacterial pneumonia, bronchitis. That is when you get a wet cough. And then the whooping cough is actually a bacterial infection, but it has a very characteristic cough where you cough in bouts. So you cough, 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 and then at the end of the cough, there's like a whoop sound. And in the days of old, we used to call it was part of the 6 childhood killer diseases. But these days, because of immunization, we don't see it as much, but it's still very there. So they cough in bouts, and then there's a whoop at the end. So that's a whooping cough.
Okay, thanks for this education. We'll get a bit more into that, and I'll speak to Frank about, the different treatment options that are there for dry coughs, chesty coughs, and so on. But really, we want to know, when should parents start to worry? When should they start to think of things like pneumonia when their child is coughing?
Okay. So there are some red flags to look out for, basically, as parents. So the first I want to say is that anything that is a chronic cough, and I would go further to explain. So an acute cough, when we say something is acute, it means it started just for kids in the past 2 to 3 weeks. So any cough that lasts for about 2 to 3 weeks is an acute cough. And then in chronic coughs, anything more than 3 weeks in kids. In adults, I think they use a higher threshold, and that is a chronic cough. When you see red flags like your child is having difficulty breathing or is breathing faster than usual, that is a red flag. When the lips turn blue, the fingers turn blue, that is also a red flag. It means your child is not getting in enough oxygen, and at that point, you need to be worried as a parent and then come in. Also, another red flag that you need to watch out for is when the child is not tolerating anything oral. So anything you give the child to eat, cough, 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 vomits, cough, 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 vomits, that is also a red flag, and you need to bring that child to the hospital. It means whatever we give or whatever home treatment you are using will probably not work because it doesn't even get to stay in. There are some other red flags. For example, like sounds. So you hear wheezing sounds or whistling sounds when the child is actually breathing in or out. That is also a red flag. It can be a sign of an allergic cough or asthma. So you need to bring the child in for assessments. So those are some of the few red flags I typically will tell parents to watch out for. There are quite some others as well. The child seems to be hungry for air. I call it like air hunger. They are breathing and they don't seem to get in enough air as well. That could also mean that there's something more to it. And then continuous coughing bouts. So for example, hearing the whoop at the end of cough or having long pauses in between coughs. That is also a red flag. You should bring the child to the hospital.
Okay, I'm glad that you mentioned that because with chronic conditions like this, the patient has to see the doctor.
Yes.
Now, here in Ghana, people like to self-medicate a lot. And Frank, I'm sure you on the pharmaceutical end of things or at the pharmacy, you would tend to see people come in and describe their cough. And you would have to sort of break that down to see whether it's a dry cough, a chesty cough, and so on. But with self-medication, there are some cough syrups that are loaded with sugar. And from where I sit, that's a problem for us because patients that are on such long-term medications tend to develop things like cavities and things like that. And when it comes to self-medication, how do we handle that?
So I think it's part of our practice as Ghanaians. Over the years, the person we run to anytime we have a cough or a chronic like anything of the sorts is the pharmacy. So when it comes to self-medication, I always tell people one thing you should learn to do is go back to the same place. Sometimes they go to pharmacy point A. I told them, okay, I have a wet cough and they gave me medication. It's not working. The next thing is, after 2-3 days, I'm going to point B, point C. But even if you're going to the pharmacy, now we have pharmacists in our pharmacy and they can also help prescribe. So if you have to go, stick to one person. And once you are having a persistent cough or a chronic cough, so for kids less than 3 weeks, for adults, I think more than 6 weeks, please do well to see the doctor. It's important. It may be just more than an ordinary cough. It may be the sign of an underlying illness that we need to investigate to get to the bottom.
All right. So let's talk treatment. Frank, we know that for the different types of coughs, there are different active ingredients in the cough syrups that do different things. So let's just walk us through what some of these active ingredients are and how they specifically help in the different types of coughs that there are.
Cough mixtures are made basically to treat the symptoms of cough and not to treat the underlying cause of the cough. And so for a dry cough syrup will typically contain ingredients like dextromethorphan. Dextromethorphan is an antitussive, so what it does is that it suppresses the cough center in the brain so that you are not coughing the typical dry, tickly cough. So that is for dextromethorphan. That is one way of handling dry coughs with dextromethorphan ingredients. Then for a wet cough, ingredients like guaifenesin is an expectorant. Basically, what it does is that it loosens and thins the mucus and in the airwaves so that you're able to cough the mucus out easily. And then we also have ingredients like ammonium chloride, which is also an expectorant. and also thins the mucus and loosens it up so that you're able to cough the mucus out easily. Now, there's also other ingredients like mucolytics. Mucolytics work similar but slightly different. A typical example is bromhexine. Sodium citrate is also one. What they do basically is that they break down the mucus into tiny droplets by reducing the viscosity so that you are able to bring out the mucus out when you cough. So basically, these are the two main ingredients. But we also know that aside the dry and the wet cough, there are some symptoms that come along with dry and wet coughs. So you have symptoms like allergic symptoms that come as a runny nose or sneezing, itchy eyes, and all those other respiratory and nasal allergies. So those allergic symptoms can be relieved with ingredients such as phenylephrine. Phenylephrine is a decongestant. Then you also have antihistamines. Antihistamines come to relieve the allergic symptoms, the runny nose, the itchy eyes, and the like. You also have some ingredients which help to soothe the throat and then is able to make breathing a bit easier in the nasal passages like menthol. So you are able to have this cooling sensation when you breathe in, and then it makes your throat a bit more soothing. So basically, these are the main ingredients that can be found in typical cough mixtures tailored towards dry coughs or wet coughs, and then symptoms that come along with these types of coughs.
Wow. So this is very, very informative. This means that if you have a dry cough or you have a chesty cough, you should take the correct type of cough syrup for that. If you're taking a dry cough syrup for your chesty cough when you are all congested, you are not helping yourself because the chesty cough syrup has ingredients in it that's going to help to break down the phlegm of the mucus and help you to, bring it up. So it means that if you have a cough this week, you don't go and take your brother's old dry cough syrup that he didn't finish from the last time he had a cough, right? Because you'll not be helping yourself. This is very informative and very interesting. So let's come to Luex Cough Syrup. From Frank, tell us what makes this formulation so unique, because I've met so many pharmacists that speak so highly of the formulation that the Luex Cough Syrup has, and I know there's a wide range. There's the one for baby, for children, even for adults. There's dry, there's wet, and then there's for night. So just run us through the different Luex Cough Syrups and what each of them do.
Yeah, thank you very much. I would like to say that the Luex Cough range has been on the Ghana markets for over 20 years. So It's a time-tested and trusted brand.
Right.
And for our Luex Cough range, we have two broad categories. We have the pediatric cough range and then the adult cough range. And so our cough mixture covers all age brackets from baby, child, and adult. So we say typically that is the best cough mixture range for the entire family.
Right.
So that is one unique advantage for our Luex Cough range. Luex Baby, it will interest you to know, is our fastest selling cough mixture among the pediatric range. Pediatricians love it, doctors love it, and I'll tell you why. If you look at how it looks, you can see that it has a unique, attractive packaging, yellow pack with a baby, smiling baby. And the age range is from 4 months to 5 years for the Luex Baby. And then what makes the Luex Baby so unique is that it has some 4 key benefits that it offers the baby, and it will surprise you to know the mother as well. Now, it is for dry coughs, and it contains only one ingredient, but super powerful ingredient called glycerol. Glycerol is one of the safest active ingredients to use in babies. Now, what the glycerol does, first of all, is to relieve the tickly dry cough that is very common in babies of that age bracket. And also, it also relieves the irritation in the throat that is very common in babies as well. Now, these two benefits, what it does to the baby is that it helps the baby to sleep well. And then if the baby sleeps well, mother is also having less stress. And then you have happy baby, happy mother. The third benefit is that it also helps the baby to swallow easily without pain because it soothes the throat. And so what it does is that if you are breastfeeding, it makes the breastfeeding easier. If you're feeding the child too, it's easier because the child is able to swallow without the pain. And so your child is able to grow well with an enhanced nutrition. Now, the last thing is that it offers protection by lining the throat of the baby and protecting the delicate mucosal lining from irritants and then pollutants from the environment. And so as it is relieving the symptoms, it is also giving your baby protection from external environments like the irritants and then the pollutants as well. So that is what makes Luex Baby so unique. For 1 year to 5 years, the dosing is actually 10 mils 3 to 4 times a day. Now, from 4 months to 1 year, 5 mils 3 to 4 times a day. It's very safe and very efficacious. It would interest you to know that mothers who have used the Luex Baby, that is where they fall in love with our Luex cough mixtures. They start with the baby and then they continue with the other Luex cough ranges because of the trust they've built over the years. The Luex Child Dry cough mixture is a very special cough mixture in the sense that typical of other child dry cough mixtures, they would contain only one ingredient to suppress the cough, dextromethorphan. But for the Luex Child Dry cough mixture, it contains an extra ingredient called chlorpheniramine. Chlorpheniramine is an antihistamine, and then we have other antihistamines. The reason why we chose chlorpheniramine as the additional ingredient to our Luex Child Dry is that the chlorpheniramine has a long duration of action, and so is able to relieve the allergic symptoms that come along with dry coughs, typically in children: runny nose, sneezing, itchy eyes, watery eyes, and all. And so the long duration of action of chlorpheniramine means that your child will be symptom-free with the allergic symptoms for a longer period of time. And also, it also helps the child to breathe a bit easier because when their child is sneezing and all that, it also affects their breathing because their noses are a bit congested with this runny nose and all that. Yeah, so for the dry, the 6 to 12-year-olds, the dosing is basically from 5 mils to 5 mils 3 to 4 times a day, and then your child would have the benefits of the cough mixture. Let's go to the...
Okay, so before we go to the children's chesty cough, this is just to say that the benefit of the Luex children's dry cough is not just suppressing the dry cough, but it's also targeting things like runny nose, itchy and watery eyes because of the additional ingredients that are in there. So this is an additional thing. This is like a plus for going for Luex dry when your child has a dry cough, isn't it?
Yes.
All right. Very interesting. So now we can look at the children's chesty cough syrup by Luex. What makes this so special?
Okay. The Luex child chesty cough is packed with 4 ingredients. Now, it gives it a 3-way action. It has mucolytic action, anti-allergic action, and a decongestant action. Now, these 4 ingredients are carefully selected to do that. You have your ammonium chloride, which is an expectorant. So it loosens the mucus and then it thins it up so that the child can cough it out easily. And then it also has sodium citrate, which is a mucolytic, and also decreases the viscosity of the mucus, and then it helps the child to bring it out easily by breaking it into smaller droplets.
Okay.
Now, you say that why do you have a mucolytic and an expectorant in the same formulation? We call something a synergistic action. Now, these 2 combined ingredients have a way of making the mucus clearance in the airways more effective than if you were using only one.
Okay.
So the mucosal clearance in the airwaves is far better with these 2 ingredients combined as against having only one ingredient. And then also the other 2 I'll talk about is menthol. Menthol is a unique ingredient we've added. The reason is that it soothes the throat and it also gives a cooling sensation to the nasal passages so that the child is able to breathe a bit easier and indirectly helps to decongest, the nasal passage. So the child is able to have easier to breathe, and also the nose is a bit clearer. Then you have your chlorpheniramine. The chlorpheniramine is the antihistamine, and it's taking care of the runny nose, the sneezing, watery eyes, itchy eyes, and all the other allergic symptoms that come along with a chesty cough. So with our Luex chesty, child chesty, you are dealing with all the other symptoms that come together to make your child's life a big issue. When children cough, with especially the chesty cough, it's a very, very troublesome cough to handle because of all the symptoms and all the issues that makes the child uncomfortable. The child is not able to breathe well. The child's nose is blocked. The child has itchy ears, itchy eyes, and all that. So all these symptoms are taken care of with our Luex child chesty formulation.
And this is good to know, Doc, especially because when a child starts to experience a cough, it's like one thing leads to another. Then they start having runny nose, itchy eyes, ears, and all of that. So it's very refreshing to know that your Luex children's cough range is taking care of all of these symptoms at the same time. So it's not only a cough syrup as the name implies, but it's really just handling the whole flu altogether, isn't it?
Yeah.
That's
the
amazing.
Whole mechanism.
Exactly.
Yeah, sure.
That's amazing.
Yeah.
So we've discussed the pediatric range, the baby Luex baby, which is for babies from 4 months to 5-year-olds, and then the children's chesty and children's dry, which can be taken from ages 6 to 12 years old.
Yeah.
So now we can discuss the adult range, which is the adult chesty, the adult dry, and then the nighttime cold and cough syrup.
Okay, before I go to that, there's one last thing I'll talk about the pediatric range is that the taste is very palatable, and so kids they are very finicky about the taste.
She can relate.
The taste is very good. It has a syrup base, and so the taste is very good, and it's alcohol free.
Okay,
so
great.
That makes it very safe in children as well.
Good.
So that is a point that I needed to let everyone know.
Doc is beaming with smiles at the sound of this.
Because with the kids, if it's not sweet, it's not going in.
It's not going in. You're right.
And the packaging is also very attractive because after the kid takes the cough mixture, they will always remember the images and then the colors of the cough mixture. So
that's true.
It's very children friendly in terms of the artwork and the attractiveness.
Yes.
Okay, so I want to talk about the adult, the Luex adult range.
Okay.
Luex adult range cough mixtures. Adults, the cough that comes along in adults, some of them are because of lifestyle. So a typical adult who smokes will be having a lot of dry coughs.
Yeah.
And then also adults who are also engaged in occupation or a work that involves a lot of vocal exertion, like if you're a singer or you are always on the microphone, there is a lot of strain on your voice. So
That's
there's a
true.
likelihood that you'll be coughing intermittently. So that
And
is
those who work
adults,
with
and
irritants as
and
well.
then those who are exposed to environmental irritants,
Yes.
chemicals and dust and all that. Typical adults, that's the most of the causes for coughs in
Coughs.
adults. Now, so we have the Luex adult dry cough mixture. The Luex adult dry cough mixture contains two main ingredients, dextromethorphan and the menthol. Now, these two ingredients have been carefully selected to be able to do three things. It's handling the dry cough, and then it also soothes the throat with the menthol. And the menthol also has a way of giving a cooling sensation and helping you to breathe easily. So it's, in a way, giving a decongestant effect. So adult dry cough mixtures are very, very effective, and they are also non-drowsy. That is very important because for a typical adult with a busy lifestyle, you don't want to take a cough mixture that will sedate you and affect your work.
Yes.
So that is a very unique advantage of our Luex adult dry. And then the typical dose is 10 mils 3 to 4 times a day, and you are good to go. We also have our Luex adult chesty. The Luex adult chesty is also very unique because when it comes to chesty cough in adults, it is even more stubborn because, adults don't like to take medication. So most of the time, they will wait and take herbal remedies to see where it will go. That's a typical adult. Typical Ghanaian adults will go for herbal remedy before they think about a cough mixture. So you realize that by the time they buy a cough mixture, that means the chesty cough has become serious in terms of the mucus accumulation. That is why for a Luex adult chesty, it has 3 ingredients.
You are facing the typical Ghanaian adult.
Facing the typical Ghanaian adult. So you have your guafenazine in there, which is an expectorant, helps to loosen and thin the cough mucus, the mucus, so that the adult is able to bring it out a bit easily. And then you also have your bromhexine. The bromhexine is mucolytic, and it doubles up with the guafenazine to be able to clear the mucus in the chest and the nasal passages. Now, there is also a third ingredient called phenylephrine. Phenylephrine is a decongestant, and what it does is that it loosens up the mucus in the nasal passages, so it relieves a blocked nose, which also comes along with a chesty cough most of the time in adults. So with these 3 powerful ingredients, a typical adult that starts using Luex adult chesty will have a quick relief of the chesty cough and then also the blocked nose. Adults who have ever taken our adult range, either the dry or the chesty, because of the efficacy, they stay with it, and when they come to the pharmacy, they insist on the Luex brand. So that should tell you that we have formulations that are tried and tested and very efficacious. Now, the last I'll talk about is the Luex nighttime cough mixture. Now, the name nighttime typically would mean that it is tailored towards coughs that come up in the night. And for this particular nighttime coughs, children are the ones who suffer mostly from it, but adults also suffer from the nighttime coughs as well, but it's more predominant in children. So for our Luex nighttime cough, the age range is from 6 years and above. So 6 years and above can use it. The ingredients in it is dextromethorphan, because it's tailored for dry coughs that comes along with cold and flu. So dry coughs, that are predominant at night that come along with cold and flu is what this cough mixture is going to address. So, as I said, it contains an antihistamine called triprolidine. Triprolidine is a sedating antihistamine, and so it helps to relieve the allergic symptoms like the runny nose and then the blocked nose that comes along with a cold and flu. And it also helps you to be able to sleep because, when you are having cold, blocked nose, your nose is blocked. So when you are sleeping, you'll be struggling to sleep. So this triprolidine antihistamine helps you to sleep and also relieves the nasal congestion, and then also the runny nose and all those other symptoms of allergies as well. Then you have your dextromethorphan, as I said, for a typical dry cough. It helps to suppress the cough, and then it helps you to be able to sleep because you don't want to be coughing that will be disturbing your sleep. So it also helps to relieve your dry cough as well, and then helps you to sleep. Then you have your menthol. Menthol giving that cooling feeling that soothes your throat from the throat irritations, and then also helps you to breathe easily, and then gives you that cool feeling around your nasal passages. So for nighttime coughs, we are reintroducing this on the market. It went out of stock because of the high demand, so we will reintroduce it onto the market.
As a beneficiary of this nighttime cough and cold syrup, I was actually going to mention that is this still being produced? Because the first time I tried it, when I woke up in the morning, I said, where has this been my whole life? Yeah. And, for some time, I couldn't find it on the market. So I'm glad that you mentioned that it's going to be reintroduced on the market.
Yes. We are going to reformulate it and even make it much, much better. So watch out for nighttime cough, Luex nighttime cough when it comes back. It's coming back with a big bang. And all our cough mixtures are in 150 ml volumes. And that is an extra bonus for the typical cough mixture that comes as 100 mils. But with the 150 is good enough to last for the duration of the treatment.
Right.
One thing I would say about the cough mixtures is that previously it was imported, but for the past 4 years, it's been manufactured here in Ghana.
Wow,
in our ultramodern factory on the Spintex Road. In Unichem, we believe that we should support local manufacturing.
Yes.
And also we believe in creating jobs for Ghanaians.
Yes.
And so that is a strategic decision taken by the directors of Unichem to help the economy to grow. I would want you to also probably pay a visit to our factory if you are free, Dr. Louisa, Dr. Sharon. I think
Gladly.
you'll enjoy the experience. And you'll see that the quality that I'm talking about is no fluke. You can actually, up close, look at the diligence and the quality built into every Luex cough mixture. And then you would actually also testify and also let your clients and your patients know that we have something that Ghana should be proud of. That's a Luex cough mixture.
Wow.
Nice.
Thank you so much, Frank, for this education. I mean, it's such a well-rounded formula. I love the fact that it's not just targeting your dry cough or your chesty cough, but it's also targeting all other things that come with the flu, your runny nose, your blocked nose, and all of that. So that's really good to know. Doc, I'll come back to you. There's a problem here in Ghana we have with abuse of antibiotics, and especially when it comes to upper respiratory diseases and with cough, flu, and things like that.
Yeah.
What is your take on this? Because a lot of people would, first thing they'll want to do is to start antibiotics when they start coughing.
Yeah. And it's a pandemic.
Yes.
I don't know where it started from. I wish it never started, but then it's here. So we need to find a way to
and
curb
educate
it.
the people.
Yes. So as we said earlier, just in case someone missed it, most coughs are actually caused by viruses, especially in the pediatric population, where about 80 to 85% of coughs are viral coughs. And so when you go in for antibiotics that were created for like bacterial infections leading to cough, like a pneumonia that is from a bacteria, or a bronchitis that is from a bacteria, it's like killing a chicken with a hammer or something. I don't know, but
the bulldozer.
It's an overkill.
Yes.
And in the process of going in for that overkill, you're actually causing more harm to the body, because in this day and age, we have what we call antimicrobial resistance or antibiotic resistance, where we have patients coming in, they are very sick, and then we are trying to find out which antibiotic can work for them. But because they have used so many over-the-counter antibiotics at various points, and their body has sort of adjusted to the antibiotics or found ways around the antibiotics. Right. Now we are not able to get antibiotics to actually help them. Sometimes we have to go in for more expensive brands or brands that we can only find outside the country. And sometimes it doesn't even give us an option for like a brand. And this is actually a real pandemic, and it's real. We have patients day in, day out coming with these antimicrobial resistance. So when you have a cough, please deal with the cough. If it is a cough that is concerning, visit the hospital. And if the doctor thinks that it's a bacterial infection, that doctor will give you an antibiotic. So I keep telling my parents, sometimes mothers come into the consulting room after you've done everything, you didn't give them antibiotic. They go out, sir, doctor, no, that doctor is not good at all because I didn't get an antibiotic. And sometimes they even know the names. They didn't give me amoxiclav, or they didn't give me and I'm like, no. These are antibiotics that are used to treat bacterial infection. And your kid has a dry cough from a viral infection.
Right.
So just a simple cough mixture, the antihistamines and all that Frank took us through should be just fine to help. So please, the next time you have a cough, hold on the antibiotics. Very, very important.
Very important. Very. And it's a pandemic, as you described it, actually, because it's a new craze where before they even come to you, they've already gone through a series of antibiotics and they are reporting. So this is very important. Frank has taken us through the different ingredients that make up, especially the children's range. It's not just targeting the cough, it's going to target things like your sneezing, the blocked nose, the runny nose, the itchy and watery eyes, and all of this. So thank you, Frank, for this education.
I actually wanted to add that the fact that 2 weeks ago you had a cough, probably that was chesty, and you were given antibiotics, doesn't mean a month later when you have a cough that is also still chesty or maybe dry, also requires an antibiotic. Every cough comes with its peculiarities.
Yes.
So some people would keep the antibiotics as if with like 2 tablets or 4 tablets, and then the next time they are coughing, they go in for that. Please, that is also.
And another thing, you should complete your dose, the course of the antibiotics, because people start, if your doctor recommended or prescribed antibiotics for you and you start taking it in the first 3 days, you're okay. Then they stop taking it.
Yes.
And that's also not too good, and it's helping with our issues with antibiotic resistance. Wow, so this has been a very insightful and informative conversation, and we've learned a lot about the Luex range and really about coughs in general and cold and flu, and about antibiotic use, over-the-counter self-medication and all of that. But before we wrap up, Frank, Dr. Sharon, is there anything else you'd like to add?
Okay, so typically, some people combine cough mixtures. Sometimes it's because when we start on one and it gets finished, they have an old one and then they say, oh, it's the same cough, so let me just take the old one to add. Now, what you are doing is that every cough mixture has different ingredients, and so if you take another cough mixture to top up what you were using before, what you are doing is that you are combining ingredients together, so you can have an overdose, because these ingredients found in cough mixture A can be found in the same cough mixture B.
Right.
And so you are going to have an overdose, and it will give you more side effects.
Yeah.
So please do not combine 2 different cough mixtures and take at the same time. And then do not combine herbal mixtures with your prescription cough mixtures. Don't do that because they have different ingredients and that the ingredients can interact and give you some unpleasant side effects as well. If you are diabetic or hypertensive, you need to let your prescriber or your pharmacist know before you are given a cough mixture, because some of the ingredients may not be that safe for patients of that category. So please let your doctor or your pharmacist know about your health status or other underlying conditions in addition to the cough mixture, and I think they will help you. Thank you.
Yeah, that's very important. I'm glad that you mentioned that. Dr. Sharon, any final words as we close the curtain on our conversation?
Yes. Just to add to everything that has been said, I think today we've spoken a lot about coughs. And coughs, colds are actually the most common complaint in kids. When we sit in the pediatric clinic, about 90% of the time is always a cough or a cold, especially for kids under 6 years. And we now know that not all coughs are the same. We have wet coughs, dry coughs, and they all have their peculiarities. So when you're concerned about your child having a cough, persistence, some of the red flags, please visit your doctor. We are always there to help anytime, any day.
Yeah. Thank you so much from Frank and Dr. Sharon for joining me on this conversation. I almost was wishing it would never end, but we've come to the end of the conversation. Thank you so much for watching. We would gladly take your questions in the comment section. Please do well to like, follow, and subscribe, right? Okay, so till next time, see you. Bye.
Bye.